I am personally very familiar, unfortunately, with the feeling of guilt, the feeling of falling behind, and the feeling of being in trouble. It's actually related to my feeling of anger. When I'm angry with other people, it's because I detect their misbehavior and them falling behind. So it's really about my feeling towards a self, whether it's my own self or the self of another, that ends up creating guilt. Because anger, if I'm angry at someone, I am trying to make them feel guilty and getting them to behave differently using that emotion of mine. The reason I bring this up is because guilt and anger go hand in hand, and they actually make a person feel less powerful. The angry person may be displaying power superficially, but the angry person is themselves in a position of defensive insecurity and coming from the fight or flight response, which demonstrates a decrease or a lack of intestinal fortitude. Someone who's losing control of themselves and going crazy to other people, or someone who is procrastinating on an important project, both are actually lacking in power or intestinal fortitude. And this was brought to my mind because of some projects that I'm doing with OR Nursing Leadership, but also because of a presentation that my friend Dr. Jen Cutler did today on the brain-gut connection and how to use that information, which was a beautifully well done neurologically and microbiologically and chemically based presentation that described and skirted around the issue of the role that our gut microbiome plays in our own health. It was emphasized what drugs we should use or avoid in certain kinds of patients, but certainly with Dr. Emran Mayer's work, who was also cited in the presentation, the question of healing becomes more and more expansive as we consider the human life as broadly as possible, because we have physical, emotional, mental, financial, and social wounds. And I recorded a longer video, a 12-minute video, but this is a 3 or 4 minute video, as I promised, because I wanted to really keep Dr. Cutler's attention and ask her if this is interesting to her, this question of healing social wounds, healing financial wounds, healing mental wounds, healing emotional as well as physical wounds, and what this has to do with intestinal fortitude, with power, with strength, and with mental fortitude, and with focus and discipline and the ability to really suck it up, as it were. Because all of us have gone through insensitivity training early in life where we learn not to be crybabies. But it has left some of us quite cold-hearted and antisocial. As such, those social wounds continue to perpetuate until we're able to actually move past being cold-hearted and melt our hearts again through various exercises and references to states of consciousness. So I hope this has been an interesting proposition that I'm making to spend some further time exploring together as a team, really in the Department of Anesthesia also, and in Cedars-Sinai at large, this ongoing maintenance of what we can call the vital signs of the physical, emotional, mental, financial, and social ecosystems or layers of our lives, of our conditional lives. And also the vital signs of our conversations. The vital signs of our conversations, which end up being actually the modules that become the vital signs of our relationships and of our culture. So I'll leave it there and look forward to talking.